The first speaker of this session is Professor Midion Mapfumo Chidzonga. He is respected senior academician in the University of Zimbabwe, and he was the first dean of the and now thriving dental school. His specialty is maxillofacial and oral surgery. He also have a higher qualification in education and public health. Please, the floor is yours.
Right. Basically, my presentation is based on COVID-19 pandemic, the inequity, equity, and iniquity involved in the pandemic, COVID-19 pandemic. Basically, we all know that coronavirus disease, the cause of the COVID-19 pandemic was caused by the SARS-CoV-2. So when we talk of the inequity of what is caused by the pandemic, there's global disruptions in the economy, social and education. And so the inequity is that it has actually overwhelmed health facilities in most countries, the developed countries and the low middle income countries. Next slide, please. And also, particularly the low-income and middle countries have been heavily affected because in all this time, their health facilities are under strain because of the common diseases that are common in our environment. And of course, the economy, the little economy that was about to thrive has also been hard hit by the closure of businesses. And most of our economy has been involved in tourism. And of course, the closure of the travel bans, which was necessitated by the COVID-19 pandemic, has led into actually virtual collapse of the economies. And of course, the unemployment. When you bring in the issues of lockdown, you find that most schools, universities, businesses had to close down again, which led to very difficult situations. The education system is also strained, and the lockdown has not helped in any way. And of course, the social distancing has been very difficult to implement in view of the fact that most of our communities, particularly in the urban areas, are crowded, and even the transportation system is crowded, which made it very, very difficult. And also came the issue of vaccines. The low and middle income countries are the last to receive vaccines, and most of the vaccines we have been accessing have also been donated by other countries. And of course, we could not access the other markets in the high income countries. As you all know, the inequity involved by the hoarding, most of the countries are hoarding. They're now moving into the third vaccine, when Africa, most of the countries actually have not even started the first vaccination. And of course, there's also limited access due to the unavailability of the vaccines. Next slide, please. And of course, we said Africa is still struggling with the administration of the first dose, and of course, with also the misinformation about the effects of vaccines on our communities. People are resisting, and of course, the myths that some of these vaccines are meant to exterminate people from the third world. And of course, our countries themselves, they're indebted with the expense of buying vaccines. They're not able. So that's where the equity, the WHO and AU have tried their level best to access the vaccines to these poor countries, but unfortunately, they're meeting with resistance, as most of the vaccines have been bought well in advance by the rich countries. Currently, most of the countries in the poor countries, particularly Africa, are relying on donors like Russia, China, etc. And of course, most of these vaccines are being actually derogated by the Western countries, and equitable distribution has not been possible, such that most of these countries are left behind. And of course, even the PPEs, again, they're in short supplies, and most short countries have now started preparing their own PPEs. And of course, the vaccines, we're still a long way off from preparing our own vaccines. And I believe that's the route to go. Africa we have the expertise, but we do not have the infrastructure. So poor countries must be encouraged to spend most of their monies, at least a reasonable amount of their money, in acquiring the infrastructure to develop our own economy and also develop our own expertise Most of our experts are outside the countries and actually doing wonders there, but of course our countries cannot afford it. We mentioned that education has been disrupted. Again, our education has been below par, and also this COVID has meant further deterioration in our education system. And of course, we were ill prepared for the pandemic, mainly because of our health systems. Next slide, please. Next slide. So most education institutions are struggling to implement the online teaching because of the poor infrastructure. And of course, some of the online teaching facilities require expensive equipment, which the countries are finding difficulty in acquiring. Most of the online teaching is done on a rudimentary position, and the inequity involved is clearly shown by the Omicron virus, which some countries in the West are calling it the African virus, which is most unfortunate. The fact that South Africa was the first to announce the detection of this virus, it has placed the plague on Southern Africa. As you are all aware, the Southern African countries, almost all Southern African countries, were the first to be banned for travel abroad or for visitors coming in, which we rely on as far as our tourism is concerned. But of course, they were still coming for our wealth. The scientists who discovered, or at least who publicized the Omicron virus, believe they are being penalized for sharing their scientific information. And yet, the current spread of Omicron virus in, say, Europe in particular, was found actually most of those persons had never traveled to our region, but our region is now being blamed for possible transmission of the virus. Again, that's the iniquity of the COVID-19 pandemic. And of course, there's the criteria for travel ban has been discriminatory. Only specific countries, poor countries, have been targeted. Yet within the rich countries, people with Omicron virus have not been banned from travel between their countries. Next slide, please. I mentioned earlier on that most of our scientists have left the countries mainly because we have poor science infrastructure, which I believe can be rebuilt, and we should be able to compete with the rest of the world. And I think this is the way to go, all the poor countries to develop the health system, have the right infrastructure, and then we should be able to compete with the rest of the world in preparing of vaccines. And of course, our education system will also be improved. Again, we need to start building self-sufficiency. I think that's all. Next slide, please. Thank you very much. Thank you very much. Thank you.
Thank you. Thank you, Professor.
So please remember, if we all help and do a little bit, it will make a big difference.